Yes, this is Miss Harper again. I'm still playing around with this computer, still playing around to see how things operate. Um, geez, trying to see here. Where can I get the best footage for my lectures at the same time? Okay, I think this will do it. Oh, okay. Good evening, class. We're going to talk about anatomy physiology part 2 of the anatomy physiology. This is a pickup from yesterday conversation. We already talked about part 1, the importance of healthcare terminology in your field. So now we want to delve into body structure and the importance of body structure and how that plays a role in medical billing and coding. Okay, so chapter 2 in your textbooks that you see online in your class, or maybe a hard copy that you have on hand, and you already know according to the syllabus what textbook that is. We're going to talk about body structure and directional terminology. Okay, now considering this, the organization of the human body. You have human organisms. Body systems are made up of a number of organs. Each organ is made up of tissues. Tissues are made up of cells. So systems, organs, tissues, cells. So that it just breaks it down where it starts from. Everything starts from a cell. And then everything's from a cell, cells gather up together to make a tissue or a muscle of some sort. Okay, and then it forms into an organ, and then the organ has a function of the body. Remember yesterday's video conversation, we talked about the 11 to 12 or 13 different systems of the body. I'm going to get that number right, but I know it to be about 12, okay? But we're going to get it right. So each organ has its role and what it does. Now, why is this important? I'm glad you asked. It's because digestive system has its role with the pancreas, with the gallbladder, with the intestines, large intestine, small intestine, the stomach, the anus. It has its personal role with that. The esophagus, all that plays a role with that. You have the cardiology part where it has a role with the circulatory system and the heart. Okay, and it plays a role in how everything functions heart-wise and with blood pressure. So those are just two examples. However, the reason why you need to know the 12 systems of the body is because sometimes as a medical coder, as a medical biller, you're going to be working for a specialist, okay? And that specialist may be a gastrointestinal doctor, cardiologist, a nephrologist, ophthalmologist, neurologist, a doctor that deals with hematology, that deals with the blood, AIDS, pulmonologist that deals with the lungs, an orthopedic doctor, musculoskeletal doctor, dermatologist, reproductive doctor. You have male and you have female, so they're separate. Okay, so that's about 12. That's about 12. So each medical coder has their own specialty, and again, sometimes you may work for a family practice physician, internal medicine physician, general practitioner, someone general of nature that sees the whole family, the whole gamut of people. Sometimes you may work for a pediatrician. Sometimes you may work for a surgeon that specialize in doing nothing but surgeries or surgeries of the gastrointestinal tract, which may be a bariatric surgeon. Not all coders are exactly alike. So that's why it's really important that you learn your body system. Your body system of what you know will help you be more particular, more specific in coding of what you do for your career. If you happen to like being a surgical coder, that may be the career for you. If you enjoy being an OBGYN coder, that may be the career for you. Not all coders process the same. The foundation is the same, but the process is similar, but not exactly the same. Okay, so I hope I made myself really clear on that. But we're all brothers and sisters in the career, right? Amen. And so we all help one another getting the job done so that the physicians can get paid, the nurses can get paid, we can get paid, everyone else can rightfully get paid. Okay, see my glasses. I still see gunk on my glasses. Oh well. All right. So the next thing we're going to talk about is homeostasis, which is the normal process of maintaining balancing stable within the blood. The cells are the smallest basic unit of the body cells. Cells have characteristics. They have energy. You have metabolism. You have anabolism. And you have cannibalism. Okay? The cell's components are the cell membrane, the cytoplasm, the nucleus, and the DNA. Okay, the DNA is very important. It gives hereditary information. It allows the cells to reproduce. Now, we do know.
Call from 832-659-0340.
We do know that the DNA strand gives a lot of hereditary type information. If you happen to be a cancer patient, sometimes they will have you, more so now than ever, to do a BRCA test. That BRCA test will allow you to find out how close in range are you to develop this cancer or redevelop cancers in the future. It also gives the physician, the researchers, opportunities to know if you need stringent chemotherapy. Now, what I mean by stringent chemotherapy is the amount of chemotherapy, the long-term treatment of chemotherapy, because chemotherapy is a risky, dangerous type drug that one needs in order to be in remission or to come out of risk of cancer. And I can say that I am a 5-year breast cancer survivor, and I had to do my just diligence with 5 months of chemotherapy, and I'm on 5-year regimen of chemo pills, 2 different kinds, one for 3 years, another for another 2 years, and then I'll be back on another kind for another 5 years because of my risk factors. Okay, so I'm grateful. I'm grateful for modern technology. I'm grateful for medicine. I'm grateful that God gives us the inventions of medicine so that man can survive longer, and so I'm grateful for that. Okay. All right, fantastic. So we have to know that if you're going to be an oncology coder, you need to understand BRCA analysis. You need to understand the lab work, particularly if you're going to be that type of person that's going to work long-standing in the health information technology field, okay, health information management field. In the health information technology field, you're learning clinical documentation, you're learning management, you're learning coding, you're learning all the things that's necessary for a plethora of things for you to grow into the field. My next challenge to you in the next class setting, or if you happen to email me, You can email me at thcod at hotmail.com. And those that are my students that's in my class, you know my email at work. You're more than welcome to email me at work, and I'll answer all your questions. So it's real important to learn as much as you can. You're starting at the root of the foundation as a medical coder and biller, and then you grow your way up as you go. It depends on what you like, what you're good at, where your talent is most needed, where you can blossom the most is where you grow the most. Okay. All right. So we want to talk about organisms in the next slide here, talking about the lecture note slide for Chapter 2, Medical Terminology, in your Medical Terminology book, the Shiloh book, if you will. You have, again, it talks about the importance of breaking down medical terminology. So once you learn, what is that? Root words, suffix, prefix, combining forms, then you understand how the words work together. And as I said yesterday's video, when you learn medical terminology, it's just like learning it's just like learning a language in a foreign land all over again. So you're becoming more familiar with that. Other folks may not understand it and get it, and that's okay. That's not for the lay folks to know. That's for you to know because you went to school for it and you're in the profession and you're growing in the profession. So that's what makes you set apart from anybody else of what you know to do. Okay? All right. Organization of the human body. You have the epithelial cells, which is protective covering for organs. It's most prone to cancer because of contact of the environment. You have the connective organisms, which connects, protects, supports, and forms a framework. You have the muscular skeletal cells, which provides movement, maintains postures, produces heat. And you have nervous, which provides the transmission of nerve impulses and such. Okay? Organization of the body, tissues. So you have to be careful when you're learning the medical terminology, my and myo. You have my, M-Y, and you have myel, or mile, M-Y-E-L-O, okay? Myo means combining form of the muscle, and myelo means combining form of the spinal cord, bone, and marrow. Okay, fantastic. All right, now the epithelial cell, coming back to that, is the outer layer of the skin or lining of the digestive tract or respiratory, which I like to talk about these type of cells. They're more of your kind of what you call self-recovering type cells, but then they can also be interrupted. And I say self-recovering because on the inner cheeks of your mouth, if you ever chew or bit down on the inside of your cheek, and you notice you have a scar, or maybe you brushed your teeth and you have a scar the inside of your cheeks, those are made of epithelial cells. So over time, within 2 or 3 days, sometimes in a day, they tend to heal itself very quickly, very quickly. So the same thing, you have epithelial cells inside your digestive tract and the fundus of your stomach. So your stomach is right here, okay, the body of your stomach. Then you have the jejunum, duodenum, you have the small intestine all the way down to the large intestine and then the anus, okay? And then you also have the esophagus, you have the heart that sits right on top. The apex of the heart sits right at the mouth of the stomach, which is sometimes called a hiatal hernia. And we'll talk a little bit about that. So the reason why it's called a hiatal hernia, because the apex of the heart sits at the mouth of the stomach. And when you chew, let me give you a good example as best as I can. Whenever you're supposed to masticate 25 times, you're supposed to chew 25 times. It's called mastication process. You're supposed to chew. So whenever you swallow, it opens and it closed, but it doesn't open that much. It opens just enough for it to slide through, and then it closes. Open and close. When you're a person that has been overweight, morbidly obese for a long period of time, or you're a person that tends to eat on the run and you're sucking in a lot of air, then you eat, close, eat, close, eat, close. You tend to restrict that until it doesn't close the way it should close. So what ends up happening? You end up developing GERD, which is acid reflux. And so whenever you lay down, you're always like, oh, I get heartburn, and oh, I feel this acidity in my esophagus. And what is that? It's because you have worn out the elasticity of your esophageal closing to the fundus of your belly, which is your stomach. Okay, so that's why it's called a hernia, because it's sprung. It's not able to close on its own healthy wise or naturally the way it should. So doctors have to go in and close that, and you have to be on like a liquid diet or something of that sort to help that to heal but yet redevelop. Now, also sometimes with epithelial cells in your stomach, you tend to develop what they call canker sores. Canker sores are derived from when your immune system does not do well. And so you break out those concaves in your mouth. It's kind of like ulcers. And it doesn't mean you've done anything wrong. It's just you're a nervous person and you don't handle stress too well. And so that means you lack vitamin C. You lack the nutrients to help keep your immune system up to par. And I used to get this in college all the time as a freshman. I would be stressed. And I couldn't understand why I would get that until I had the campus physician explain that to me. And I had to go out and buy me some vitamin C pills. And I had to start drinking and eating a lot of oranges or orange juice in order to keep me from being stressed. Another thing that's stress related, that's epithelial, is ulcers. I battle with that myself sometimes. I take ulcerative medication, and then sometimes when it develops, I take it for a period of time until it solidifies itself. That inside your body has epithelial cells, and it tends to heal over time. But you have those organisms. Sometimes if you have H. pylori, sometimes you have other internal organisms, it'll cause you to have those ulcers. Okay. And so if you're a person that worries a lot, you don't do well with stress, you don't digest your food a lot. I know me, if I'm that kind of person, if I'm stressed, I don't eat well. I don't eat, because if I eat, I'm not going to digest the food very well, and it's not going to really metabolize well in my body, and it'll just make me sicker. So I tend to de-stress myself by listening to jazz music, as you can hear in the background. It relaxes me. I love reading. I love hearing my audible books. I do whatever it takes to relax me. Okay, so find whatever mechanisms you know to relax you. Go walking, walk the dog, watch your favorite TV show, laugh. Laughter is like medicine, so it helps you to heal. Okay, all right. Connective tissue, which is bone, blood, fat, tendons, lymph nodes. You have muscular, which is the heart, the skeletal, the visceral muscles. You have the nervous systems, which is the nerve, the spine, the spinal cord, and the brain. Okay, so tissue replacements. I'm going to move on. Organization of the human body. I'm going to move on from that. A lot of this it's like 63 slides, so I'm going to kind of move on a little faster here. We talked about the apex of the heart, so that's good. You have, let's see here, kidneys, the ears, the uterus area, the lumen, which is the ventricular area, the body systems, great. So you have musculoskeletal, integumentary, gastrointestinal, urinary, reproductive, lymphatic, blood, and immune. You have cardiovascular, respiratory, nervous, endocrine, and special senses. Okay, all those are the parts of the body. So let's see here. There's five. Let's see, 5 and 6. It lists about 11. And I would say it's basically about 12 because you have the female part, the reproductive of the body is male or female. Okay, so to me it's about 12, but it's 11. Okay, so you have specialists and specialties. You have the let's see here, pathologists. The pathologists, they do a biopsy. So again, if you are a coder working for a surgeon, maybe a gastrointestinal, maybe a breast surgeon, they're going to do a biopsy of some sort of that particular organ of the body. And that particular organ is going to be, that particular biopsy is going to be viewed by the pathologist, and they're going to give their return of information or interpretation to deem the diagnosis of that particular tissue. Okay, let's talk about anatomic position. So anatomic position is the frame of reference that is used to name the surface of the anatomy. Let me turn this down just a bit. Okay, so to be an autotomic position, an individual is standing erect, they're facing forward, their arms are at their sides with palms facing forward and toes pointed. Now, usually on this slide, this is slide number 19, when you see a person standing like this, they usually will tell you what part of the body hurt. Is it the right side? Is it the left side? Is it the right foot? Is it the left foot? Is it this side of the head? Is it that side of the head? Is it up here? Is it in your face? Which side of the eye, right or left? You know, so it's very important because in ICD-10 coding, when they update that, they update ICD-10 to be specific on the autotomic part of the body. Was it the left leg or the right leg? You know, it keeps from using modifiers so much when you're trying to justify what side of the diagnosis was affected so much. And then the same for a procedure code. And I think I didn't talk that deeply about procedure codes, but when you're using procedure codes, you, what can I say about procedure codes? You can use LT or right T for that procedure code. So, or you can use modifier 26, modifier 27. 26 is for the interpretation of a particular report, radiology report, pathology report. 27 is the use of the machine, the radiology machine, or the machine that's used to observe the pathology tissue when the biopsy was being performed. So yes, we do have to pay for the use of the machine. It's all part of the work of what physicians do. It's all part of the work of what health technologists do in a laboratory. So they have to do that type of work with the instruments to get the return on investment. It's really important that we do that so that the technology is updated and so that hospitals will know what is return on investment, what is the plan, the longevity of this machine, so that they can keep getting quality reports, quality service out of this, and not give false information. That is a terrible thing to give false information or to give unqualified information when it's not enough data or when the data is not as accurate as it needs to be. Okay? All right. So, moving right along, we have the ventral surface of the anatomy. And I'm just going to keep moving right along. Okay, move right along, move right along. Blah, 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 blah. Okay, so now, moving to the anterior of the body. Okay, you have Anterior, which is the front. Posterior, which is the back. Okay. You have to know, where was that contact dermatitis located? Was it located on the anterior of the body or the posterior of the body? Okay, it's real important. Okay. Now, even when you're taking a radiological exam, they ask you to stand a particular way. Now, superior is upward. So now, the limb, was it the upward part of the limb? Was it the upward part of the arm? Or was it the inferior part of the arm? Your humerus. This is right up here. Well, not humerus, I forgot. Well, maybe it is your humerus. I can't remember. Anyway, your upper arms here, I'm just talking right now, is the superior part of your inferior part of your arms, okay? So when you're reading documentation or operative report from physicians, you need to know what part of the arm. Was it superior part or the inferior part? Was it the upper part or was it the lower part? Those terminologies are real important because they're Greek terminologies. You can't be so basic in saying the upper part of the arm. Well, what upper part of the arm? This could be upper part of the arm. You have to use Greek terminologies and medical terminology to be more specific in your language of conversation. Okay? All right. Moving right along here. So you have the medial and you have the lateral, okay? So medial, and then lateral. Oh, okay. Medial is going in, up and down, and lateral is this side or that side, this side or that side. Sometimes it's bilateral, sometimes it's unilateral or bilateral. Okay, so if you see those terms, bi means what? Two. Okay, all right, moving right along. Okay, so now it's saying ipsilateral and the contralateral. Okay, those are a little bit more definitive in terms. So this is going to be slide number 37. Again, I just explained unilateral, bilateral, proximal and distal. Okay, proximal and distal. Okay, so proximal is again going upward, but it's talking about the lower part. Okay, or going upward this way. Distal again is going down, and it's all about the connotation of how that word is used and what is that doctor used to explain and what part of the body that may apply to. Okay. Okay, so you have the term superficial and you also have the terms deep. Okay, superficial is on top, deep is below the surface. Okay. You have the supine position, which a person is laid flat on their back, and you have prone position, where the person is laid the opposite, but laid on their stomach. That's the prone position. Okay. Now, sometimes when a person is going through an MRI or a CAT scan of some sort, they're laying in the lithotomy position where they may have a pillow under their leg, or they may have some sort of instrument that's going to hold their leg up so that they're being looked at, if you will, or being examined or x-rayed. Okay? Dextrad, sinus trad, afferent, efferent, all these wonderful words together. Now, you have the 9 regions of the abdominal pelvic area. You have the right hypochondriac region, the right lumbar region, which is the lower back, if you will, or this part right up here where your belly sits, the weight of your the weight of your intestines is where your lumbar position, and then the right iliac. Then you have the epigastric position, the umbilical position, the hypogastric. All this is real important because when doctors have to go in laparoscopically, they need to identify which of the 9 regions did they go into abdominal pelvic wise. Okay, you as the medical coder, you're probably asking, well, why is this important? Well, I'll tell you why it's important. When you go in, or when you have the code, you have to code to know that this procedure went into the umbilical area. Okay, let's take bariatric surgery. I can speak that from experience, my first one. Laparoscopically, it went into the umbilical region. And from the umbilical region, they were able to do reconstructive surgery in those type of places, what was necessary to do the bariatric surgery. Sometimes they can run into other organs and they can see things within that one, how can I say, within that one opening. They should be able to go in. So what is it? Why is that important to a coder? You don't want to charge for, okay, we charge for the opening through the umbilical area. We went in and did the gastric sleeve reconstruct. And then, by the way, we happened to notice there was a pileup on the lower intestine. And so we got to charge for another opening for that. No, you don't charge for an extra opening for that. All that was done in one opening. You charge for one opening, but different processes of reasons that may have occurred besides the main reason within that one opening. Okay, and sometimes inclusive and not always necessary to charge for that one laparoscopic opening. But it's real important to know that you don't go back. Well, by the way, we're going to recharge this opening again to look at this, and we're going to read because the doctor noticed this, and this was within his scope of practice or license to do something about that. And by the way, no. It's going to be reported on the operative notes. And let me give you coders and billers a helpful understanding. Your notes will be audited. Okay, it's called HEDIS, HEDIS. They do have folks that will come out and audit your medical records, your electronic medical records, just to see if all of your documentation match what's being coded for procedures, match what's being coded for diagnoses. Okay, they're not just relying on the insurance companies to do this. No, they sending out actual people to audit your work and to make sure that everything that you're sending in for payment is legitimate. It helps keep down fraud. You know, back in the day when I worked at Prudential, I worked at Prudential in the late 90s, so that really tells you my age. And I enjoyed it, loved it, and I helped out with a lot of fraudulent claims. Fraudulent claims was becoming very big. They had the Office of Investigators to be a part of that. And I loved it. And so I was a part of that where I found a lot of fraudulent physician addresses were not legitimate addresses. Okay, they were going to other places, and these folks were setting up as fake, phony physicians. It's quite interesting, very interesting. So, what is Ms. Harper saying in the medical coding field? And it's not to frighten you. You're gonna make mistakes. You're gonna. It's not for you to go into the field nervous. That's not what I'm saying. It's to let you know that there are checks and balances to everything that we do. There's accountability for everything that we do. So make sure that you stay as clear and as honest and as ethical as possible. Make sure you know whatever agency you are certified with, whatever agency you are licensed, make sure that you review your rights in your scope of practice as a medical biller, what you can and cannot do. Make YouTube your friend. Well, you know, this is fraud, this is not right. Oh, the doctor wants me to upcharge, the doctor wants me to do this, the doctor, okay. You need to know, especially if you're in school for this, you need to know from your professors, your teachers, what is within your scope of practice, what is the right thing to do, what is not the right thing to do. I also tell my students, make friends, not make friends, but have a good networking relationship when you call these insurance companies to verify claims, to verify insurance. You'll be amazed at some of the things that they will share with you because you have made yourself audibly visible to calling them and having yourself uh, in network, if you will, to ask questions. Sometimes you'll have a good customer service rep, they don't mind answering your questions, and you have some that just, you know, they only about the job and that's about it. You know, so don't get your feelings hurt, don't take it so personal. Just call back and hope and pray you get a good one. Okay. All right, moving right along to the next slide. So moving right along, right? Okay, so it explains all of this: sagittal, mid-sagittal, frontal, coronal, transverse. Those are real important. You have the different terms here, and that is it. That wraps up chapter 2 in your anatomy physiology terminology book. And I hoped you learned something from that. I hope what I said to you was fruitful to your understanding of terminology, why it's very important. And I hope to hear from you real soon in class. Remember what I said, I will give a pop quiz based on my videos. I will give a pop quiz based on the slides. So you can sit up here and play if you want to, but I'm very serious about those quizzes. Mm-hmm. All right. Well, you have a wonderful evening, and we'll see you on the next video.